I was shocked. I was shocked at this number here. In Quebec, 679 people died last year in healthcare facilities due to falls, medication errors, or treatment mistakes, a rise compared to 2 years ago. A lot of health incidents and get a load of this, not just deaths here. According to the 2023-2024 report on health incidents, over 502,000 adverse events were reported. Let's talk to Paul Brunet now. He's a patient's rights advocate. Hi, Paul. Welcome to the program.
Hello, good morning.
Listen, before we get to these incidents that are happening, these deaths in facilities, I just want to ask you off the top, because we had a great discussion with our listeners about 20 minutes ago about charging people for not showing up for healthcare appointments. You're a patient's rights advocate. I wonder how you see this. People who make 3 or 4 appointments, they don't show up to their appointments, and then other people can't be seen. How do you view the notion of charging for a no-show?
Well, I totally disagree with it.
Why?
Because upwards, let's say something here. In terms of appointments in hospitals for surgery or anything, it is proven for the past 10 years that 80% of the no-shows are not due to patients, but due to administrations and doctors. So if I were a good, entrepreneur, I would work on the 80% before trying to, to slam the patients.
Yes. Well, listen.
Why do we insist working on the 20%, whereas themselves, the ministry and the hospitals are responsible for 80%. Tell me that.
And you bring up a good point, because I've been told on good authority, we've put the entrepreneurs in charge. We've put the business world in charge of certain aspects of Santé Québec.
The other element is the private clinics. Yep. I understand that some clinics, the performing clinics, call you to confirm and make sure that if you can't come, that you can call them back. They all are organized. Yeah. Some of the clinics, it's the black hole. You don't know where to call. You try to call. They don't answer you. You leave a message. They don't take it. But I know that private clinics who are well organized don't have the problem of no-show, because they entertain patients. Hey, this is your meeting. This is your appointment tomorrow. Let's remind everyone, when it comes to get some shots for flu or anything, we get the appointment. We get the confirmation. They call us. That's the way to do it.
Yeah.
Well, listen. So if you don't work upwards on those things, don't blame patients for not showing up, because you are responsible.
Well, Paul, I'm happy I asked you, right? Because I wanted to make sure I got that perspective, right? Because I heard a lot of people who made some great points on why it should be charged, but I loved your take there. Okay, let's get to the matter of the day here. Why we booked you on the program? 679 people dying last year in healthcare facilities.
Yeah.
How do you view these deaths? What's causing the rise in deaths in Quebec healthcare facilities?
I don't know. Really, it's quite a record high. My theory is that many more people die in emergency wards waiting for treatment. As you know, a lot of people have died and are still dying in emergency wards because they're not well treated. They're not well diagnosed, and eventually they die. So I don't have the real explanation. What I'm worried of, to be honest with you, I've been commenting for the past 12 years. The elements of falls, the elements of bad management of medication. 12 years. And it is still the 2 top items in the incidents and accidents. Are you telling me that we haven't worked on that for the past 10 or 12 years? There's a committee on vigilance, that is supposed to go after those things and make recommendations. Are the hospitals not applying recommendations, not working on those items? Maybe they're not, because nobody's accountable anyway.
Does any of this have to do with overworked staff? Because I think, this has been proven in various domains. The more tired people are, the more mistakes they will make, and that would impact care to me.
Listen, are you telling me that we've been in a shortage of health professionals and health workers for the past 12 years? I don't think so. You know why? If I was in charge of a hospital or a CACIS I hope I would get in my mark card something that has to do with results. How about in one of the items of your contract that you sign with the ministry, that you should diminish the falls by 5% in the next coming years.
Yeah.
We don't have that. We only have tasks.
Mm-hmm.
So people in charge, they work on the task, and if it doesn't work at the end of the year, what can you do? What we need is more results expected in the contracts. This is called being accountable for something. You cannot be accountable if there's no results. There's no results that you have agreed with your boss. If you don't only have tasks to realize, to accomplish, good for you, because if it doesn't work at the end, it's not your fault.
Uh-huh.
It's the one who has given you the task to accomplish.
And
what we need is figures. Today, we have that amount of falls and that amount of bad management of medication. Next year, we want 5% less. How's that? I'm sure that the head of those assistants just would work on these results because they are expected to do better. But for the past 12 years, no results. Nothing more, anything has changed.
So, but isn't that surprising? You know, we're with Paul Brunet, patients' rights advocate. Isn't it surprising, given that, you know, Christian Dubé, he's the guy, and I'm struggling to find my English word. You know, the tableau de bord. You know, like he's all about. Oh, we're going to have all the stats, and you're going to be able to go to a website and look up the data. Yeah. Is like, for what you say about, hey, here's how many falls we had yesterday. Here's our goal for the next day. Yeah. He should be the guy on that. No.
Well, that's what I've been proposing at Santé Québec. It is the time, appropriate time to change, transform the way we manage our results and objectives that we have as head of and authorities of these huge health establishment, regional establishment. We need to change those contracts that I've been studying. And as a matter of fact, I can't stand those tableaux de bord.
The dashboards, that's the English word. The dashboards, yeah.
Which are interesting, but, you know, what's the good to me to know what emergency ward is the place where I will wait the least?
Yeah.
What's the use? How about telling me where I should go for my minor illness that I have to be treated with a health professional, not necessarily going to emergency? This is the kind of dashboard that we need. We don't need to know what emergency ward is not that busy and we should go there. Of course, we don't have a lot of alternatives. We end up eventually going there. Mm-hmm. We should work upwards. Telling people where they should go and get appropriate treatment rather than end up at emergency ward again.
Let me just wrap up by asking if there's an issue with training or other things that could make some of these things preventable. I look at the medication errors that are happening. Is there something to be said for staff that, you know, they're making mistakes because they're not properly trained? Anything on that and on fixing some of these issues?
Well, you know, you have a good point, but I cannot believe, with all due respect, that for the past 10 or 12 years that I've been commenting on those reports, that nothing better has been done. It's quite something that nothing has diminished in terms of falls and bad management. Everybody knows about that. Every head and authorities were well paid, know about it. Yeah. Nothing seems to be getting better.
Paul, and putting you on the spot here, maybe you don't have this answer, but one thing that I'm interested to know is if this is Quebec specific or is this a healthcare thing? You know, if you go to other provinces, they must be making mistakes with care and that kind of thing. Yeah. But does Quebec would you know if Quebec sticks out like a sore thumb on this issue?
One thing important. I think that Quebec is one of the very few provinces who is that transparent in terms of falls and medication.
Huh.
You don't have that in a lot of provinces, and this is from the PQ in 2001, who decided to report those falls, those incidents and accidents, and later on the Liberals government have ordered that they be published. So that's, you know, that to me, it's something good because it's transparent.
It is.
Now that we are transparent, we need to work on it.
Yeah, very true. Very true. Paul, listen, we're going to leave it there. Always great talking to you. Thanks so much.
You take care.
That's patients' rights advocate Paul Brunet.